The loss of a loved one is painful. There are ways to help families struggling to cope with that loss. In our cover story, Rod Starns explains how the process helped one family.
The 24-bed Baptist-Trinity Hospice House, the first residential hospice in the Mid-South, was dedicated in the fall of 2010. The center on the grounds of Baptist Hospital Collierville helps people in their final days. The house opened just after Christmas.
We opened December 27th, 2010, so we celebrated 1-year anniversary in 2011.
Rod Robinson, executive director of Baptist-Trinity Hospice, says the facility's first year of operation has been an incredible experience.
We've been able to serve about 220 patients and their families in that first year. The staff here has just been incredible with that first year, really not knowing what to expect, but it has gone just incredible.
The staff receives special training to care for patients and their families during what can be a difficult time.
We knew that we couldn't keep her home any longer because of the care that she had to have. So we looked for a place, and we found a place for her to be. And then we learned about the hospice care because it was evident that she couldn't live very long.
Larry McKenzie's wife was the first patient at the Baptist-Trinity Hospice House. She was admitted the Monday after Christmas in 2010.
Well, for us, it was God sent because we were looking for a place because we knew the time was near, and we also was so pleased when we first came out and visited at open house. It wasn't a matter of if we were going to like the place. We already did before we got here because we knew that it was going to be an excellent facility.
The facility is designed to offer medical care, but emotional and spiritual care are also an important part of what happens there, giving families like McKenzie's the precious gift of time with their loved ones.
And their family all came in because we knew that the end of her life was near. And she died the next day at 10 minutes after 12. So she was here about 26 hours, or a little over, before she died.
Losing a loved one can cause significant levels of distress for family members. Aftercare or bereavement counseling has been shown to help reduce that distress and help people deal with the various phases of grief.
We're able to help the families after a patient dies. Here at the Hospice House, we also have the bereavement center that's located next door. So if families are already here, we can start working with them prior to the death and then be able to follow them after the death.
Bereavement care at the Kimmons-Wilson Family Center for Good Grief is tailored to what families need. Sometimes it's as simple as a staff person checking in to see how people are doing. In other cases, people may need more intensive counseling. Every family is followed for at least 13 months after a patient dies.
We just knew that it was going to be a wonderful place to be. We had no idea it was going to be so short, but we just knew that we were at the right place at the right time for our situation, and it was.
And should continue to be for others. For Smart Medicine, I'm Rod Starns.